Hello, my name is Zainab, and today I will be talking about cerebral palsy. So let's break it down. Cerebral means having to do with the brain, and palsy means weakness or problems using the muscles. So cerebral palsy is a group of disorders that affects a person's ability to move and maintain balance and posture. Cerebral palsy, you can see it anywhere in the world. In the United States, the prevalence of cerebral palsy has remained stable since the 1950s. The risk factors associated with the development of CP is within the prenatal stage. So when a woman becomes pregnant, genetic disorders, maternal health factors such as chronic stress, malnutrition, drug use, chemical exposure, and radiation can affect your pregnancy. This is why doctors stress to maintain a healthy pregnancy, because even like blunt force trauma to the stomach can increase your chances of a child developing cerebral palsy. So what are the symptoms? The signs of CP vary greatly because there's many different types and levels of the disability. The main sign that a child may have cerebral palsy is a delay in reaching motor or movement milestones, such as like rolling over, sitting, standing, or walking within 6 months after birth. Also, low muscle tone. So if you raise a child's arm and it becomes floppy or just drops back down when picked up, could mean a child may have CP. Also, if they're unable to hold up his or own head while lying on their stomach or in a supported sitting position, muscle spasms or feeling stiff, and just poor muscle control in general. So although the brain of like toddlers and children with cerebral palsy remains injured, the injury does not get worse as they develop. So depending on the level of severity with cerebral palsy, toddlers and children may experience difficulties with like physical development, such as like not walking within 12 to 18 months or just not speaking simple sentences by 24 months. So as I stated earlier, cerebral palsy is caused by abnormal development in the brain or damage to the developing brain during pregnancy. So that can affect a child's ability to control his or her muscles. So brain damage that leads to cerebral palsy can happen before birth, during birth, within a month of birth, or during the first years of a child's life while the brain is still developing, which is the reason why it is hard to diagnose cerebral palsy during those stages. So there are 4 main types of cerebral palsy. There is spastic cerebral palsy, there is ataxic cerebral palsy, there is dyskinetic cerebral palsy, and there's mixed cerebral palsy. So how do you diagnose cerebral palsy? Well, it's a complex disability and the diagnosis is not an easy process. So there is an assessment called the general movement assessment that can be conducted from birth until 5 months of age. It is a strong predictor of cerebral palsy. But sometimes the diagnosis can take a long time with repeated tests and visits to certain specialists, which can be frustrating for the parents. So, and also cerebral palsy can also progress over time. So there is no cure However, there are several treatments that you can do to maintain the disease. So there's medication. So they may describe medications that assess movement issues. They can be taken orally. Others can be injected or delivered surgically through like implanted pumps. Many children with cerebral palsy benefit from like botulinum toxin type A injection to the muscles that can affect spasticity. And this also has to be in conjunction with therapy. So occupational therapists focus on encouraging a person's day-to-day movements, such as sitting, walking, playing, dressing, and toileting. They use orthosis, mobility aids, handling techniques, and positioning equipment, such as like chairs, sideliners, to support the child during functional activities, to provide the best possible posture alignment, control, and stability. So the frames of reference that you would use for your intervention is rehabilitation, because it's a chronic disease. There is no cure. The best thing that you can do is just maintain it. There's also several approaches. So there's the dynamic systems approach, which is understanding motor behavior that proposes postural control. There's the reflex hierarchical models, and there's postural development and motor control. The types of diet. So it depends on the severity of your cerebral palsy, but some of the muscles that open and close the mouth can result in a liquid diet, puree diet, or tube feeding. Because if you have dysphagia, you cannot swallow. Calcium fortified foods such as like milk, yogurt, and cheese can help with maintain bone health. And also phosphorus foods such as like dairy products, meat, fish, seeds, and whole grains. So there's also a lot of support groups such as the March of Dimes. That's the most common one, which helps women like advocate a healthy pregnancy. There's the Cure for Cerebral Palsy, the ARC, and Parent to Parent, Cerebral Palsy Foundation, and Reaching for the Stars, which is a group that helps fund more research for cerebral palsy. And there's a lot more stuff, but I cannot cover it in under 3 to 6 minutes. So that is it.